Mobile working is transforming the efficiency and quality of care to patients across the NHS. A new convertible laptop from Panasonic, known as the Toughbook CF-C1, is set to enhance the productivity of the mobile health worker and improve delivery of patient care.
The Panasonic CF-C1 is a convertible tablet, ruggedized notebook that has really been designed for healthcare workers out in the field. It can be used as a traditional notebook if you want to write up lots of notes, but you can also then convert it into a tablet, and that will allow you to do things like capture patient signatures or use multi-touch user interfaces, even with gloves. So this is a very exciting product and will transform a lot of care in the community situations.
The NHS recognises there is a need to transform the way it provides services whilst maintaining high quality. Mobile working has the potential to offer significant benefits in two main areas. One area is the area of productivity, allowing the staff to spend more time providing direct patient care rather than travelling around the country or travelling from base to access information systems. And the second area is the benefit associated with delivery of high quality care.
Well, the benefits and savings I've seen since using the Toughbook is that I'm clearly reducing the travelling I do on a monthly basis because I've got not such a great need to go back to my work base. But also I'm able to see a lot more clients during the day. I've upped my numbers from an average of 2 to 3 to 4 to 5. I work with adults with a learning disability in the community. So I can also attend more meetings in a day, and again, ultimately the client obviously benefits.
Having a Toughbook in the car with me is a lot easier because I can make the notes while I'm with the patient. I can also see the patient's notes and see the medical history, so there's nothing unexpected can come up with the treatment. So that saves me time then when I go back to the clinic having to write up all my notes because they're already done.
BT is an agnostic provider of hardware for mobile health working and have seen a number of things that clinicians believe to be important. So things like the device being lightweight, being of a size that fits into their existing bag. Very, very important. The consultative approach that Panasonic have taken has been quite critical to the success that they've seen in the uptake of clinicians choosing their devices. With the launch of the C1, they did exactly the same and consulted it before design.
In the CF-C1 Toughbook, I can see that the enhanced battery life, having the dual battery, would be an improvement to reduce risk of loss of battery power impacting on the working day. Good touchscreen facilities to enable improved navigation around programs and software. Enhanced wireless connectivity would be a great benefit because any downtime impacts drastically on clinical time as well.
The enhancement that's been brought into play regards the C1 device is that they're now introducing a touchscreen and a tablet version of the device, which will allow operators to use it in a tablet form, and some prefer that to using the standard keyboard.
The benefits I see of having a convertible screen that would be clamshell and tablet form is most importantly for presentation of information to the patient. The traditional laptop style can sometimes be a barrier with the patient, so anything that would enable me to turn it and clearly show information to a patient would be excellent to have.
We know for sure that technology alone will not work. The service wrap that goes with it is essential. So having any airtime agreement in place that needs to be there, the service desk support, next day replacement of device. The bit that's absolutely critical is the bit in between. It's the user engagement. So operating a workshop environment to take the users on a journey is something that BT focus quite heavily on.
As a community health worker, I would definitely recommend having the Toughbook technology. The benefits for me are that it's portable, it's lightweight, I've got the patient's notes with me, so I can make the notes contemporaneously rather than after the fact, and I've got the patient's medical history with me as well.
I wouldn't go back to my old way of working because we're not so office-based now, and we have potential for spending improved amounts of time with patients for their care and reducing the amount of dead time trying to get back to office bases to put in our documentation.
As a community health worker, I would definitely recommend having ToughBox technology because it offers you a much more flexible way of working. It helps improve communication between colleagues and yourself. It means you get things done more quickly, and also just from a practical aspect, you can carry it around, you can fit in more appointments, it cuts down on your travelling. So yes, I wouldn't like to be without a ToughBox now.
I think BT see the future of mobile health working being critical to the success of the NHS if they're going to achieve their efficiency targets, not just over the next 4 years, but over the next 12 months. And I think without the consultative approach that both Panasonic and BT have taken and learning from the deployments we've had so far, then there will be no future.
It's good to see now that the mobile solutions are being used more extensively across the NHS, whereas before it was only happening in pockets. So we are now beginning to see many more organisations working more effectively through the use of such technologies as the Panasonic C1.